Who knows? Okay, so we're going to get started today. We're going to learn a little bit about insomnia. This is a very important topic these days because not all of us are getting enough sleep like we should. So we're going to kind of review a little bit about the significance of sleep. We're going to talk about the statistics of sleep. We're going to go over some of the different types of hygiene, the physiology behind sleep, and the treatments that are available. So as far as what is important during sleep, basically what happens is the body, the brain, actually organizes everything that you've been taught, everything you've learned during that day into kind of like file folders, I like to think of. And then that way you can pull upon those file folders in an organized fashion when you get ready to start your next day, or and something that comes up that you have to interpret and you remember you learned something. So it helps with organization, helps with the executive functioning, the planning, the processing. In addition to that, your cortisol levels decrease overnight. So when your cortisol levels decrease overnight, that helps to reduce your stress level. Reducing your stress level can decrease your aging, and also your muscle. Your growth hormone actually gets secreted overnight, and that actually boosts your muscle mass, which helps to increase your metabolism. So those are some of the important things that happen overnight, which makes sleep so very important, and the fact that it is very beneficial for restoration and repair. So how well as Americans are we at getting this done? Well, in all actuality, probably about 70% of us are getting less than 8 hours of sleep on any given night. There's probably about 60 or about 30% of us that are getting less than 7 hours, and 30% of us that are having trouble sleeping at least 3 nights a week. So when we go into the significance of, really what does the lack of sleep cause? Well, there's 100,000 crashes a year, and 1,500 of those are fatalities, and those are related to sleep deprivation. And it's also been known that about 6% of your basal hippocampus, part of your brain, that whenever you are lacking sleep for like 24 hours, it can only actually execute performance at a 6% level. So sleep is extremely important. Now, as far as the diagnosis as whether or not you have insomnia or you have a sleep disorder, they used to actually divide it down into primary disorders and secondary disorders, and now the DSM-5 actually no longer actually separates them out separately. They actually just clump it all together as an insomnia or problem sleeping, basically. And the way that we can look at the diagnostic criteria is if you're having sleep, or if the patient's having sleep difficulties at least 3 nights a week for at least 3 months, and they have ample opportunity to be able to be given enough sleep where they, it's not like they're jet lag, or it's not like they're in an area where they're not able to sleep. They have ample opportunity to sleep, and they're still having problems either falling asleep, staying asleep, or early morning awakening, then we can diagnose them with an insomnia condition. Other dysomnia type things are night terrors, sleepwalking, sleep talking, restless leg syndrome, narcolepsy. Those are some of the other types of disorders. Para-insomnias is what they refer to them as. Now, it's important to kind of really understand the physiology behind sleep before we get into some of the treatments and why it works. So your body actually has 2 separate types of sleep. It has an REM sleep and it has a non-REM sleep. And during the REM sleep, you go through basically stages 1 through 4. Your first stage is a very stage where you're alert and then you're not alert. You're alert, then you're not alert. Stage 2 is your slow sleeping stage, and this is actually your slow wave stage. This is the most important time for your sleep. During this period, it's about a 2-hour time that you will stay in stage 2. And then your stage 3 and 4 are your deeper sleeps, like into your delta waves. Now your REM is your rapid eye movement, and your rapid eye movement sleep is actually divided into a phasic portion and a tonic portion. The tonic portion is actually controlled by the parasympathetic, and your phasic is actually controlled by your sympathetic nervous system. Now, there are 2 separate sections anatomically within the brain that control sleep. And one of them is the suprachiasmatic nucleus, which is found in the hypothalamus. It's actually regulated on a 24.2-hour day. It kind of helps regulate your circadian rhythm. And it sends all the information down to the pineal gland, which is the gland that secretes melatonin. And melatonin is a very important chemical that comes out at about 8:30 at night and aids in basically relaxing us and helping us fall asleep. Now, the other part of the brain is called the ventricular. It's the ventricular lateral preoptic neuron. And this is actually regulated by types of chemicals known as GABA that helps to cause inhibition of excitation and helps to relax us. So there are tons of chemicals that are involved in both of these anatomical sections. As I mentioned, the suprachiasmatic nucleus is actually based on things like histamine and cortisol, which helps keep us aroused, help keep us going throughout our day. Whereas the ventricular lateral preoptic neuron is actually based on your GABA chemicals. So that kind of gives you a little bit of idea of kind of the physiology behind how sleep is conducted throughout the brain. So what can we do? I mean, as a pharmacist, I think it's important not to just know what all treatments are out there. But I think it's important to understand how do you counsel a patient on them having an inability to sleep. What kinds of things do you look for? What kinds of questions do you ask? I think what's important is remembering sleep hygiene. So, why is the person not sleeping is a very important question. Is it because they're having pain? Is it because there's an anxiety condition that's going on? What kinds of things do they have in their mind? What else is going on outside their life? What medications are they on? I mean, so many times I think you as a pharmacist probably see this in your own practice is that, you have children that are not able to sleep and you look at their regimen and they're on ADHD medicine, and a lot of times that last dose is, 4 or 5 o'clock in the evening, trying to stimulate them enough to stay awake and do their homework, but in all actuality, it's keeping them up at night. So it's very important that as a pharmacist, we are educated enough to know what to look for and how to assess the person. But on top of that, without just recommending drugs, it's very important to think of proper sleep hygiene. And I think with sleep hygiene, what we really want to focus on is maintaining a consistent routine. Going to bed and waking up at the same time each morning is extremely important. The other thing to keep in mind is to avoid a lot of stimulatory actions that happen right before bed. You don't want a lot of nicotine. You don't go out of caffeine. If you want to exercise, it's great, but it really should be about 3 hours prior to bedtime. And what about meal? Meals should be about 3 hours prior to bedtime, unless you want a snack. So what kind of healthy snacks are good to have right before bed? Snacks that help with relaxation are things that contain calcium, things that contain magnesium. Also, you have an equal portion of your carbohydrates and your protein. What is beneficial about this is the fact that your sugar levels are not dropping and peaking. So basically, you're keeping your insulin levels regulated. So it's important. The best snack, or probably the one that looks the best, is going to be a Greek yogurt with a little bit of granola and a little bit of almonds on top. Almonds have your magnesium, the yogurt has your calcium, and then the granola is your carbs, and the Greek yogurt has a good amount of protein. So that's probably your best snack. Now, the other things that you can do is try to create the environment to benefit with sleep. So when we talk about creating the environment to benefit for sleep, we think about basically releasing your day, step by step. What did you do? What did you get done? What were your plans? What did you stick to? Kind of releasing the day. The other thing is positive affirmations. Go through the day and congratulate yourself on things you've done. Be thankful for the things that happened for the day. Be grateful for what you have the next day. And the other thing is really just you can do guided imagery as well. And basically what that means is to sit down and meditate. Let your eyes relax, let your breathing take over, and that's the only thing you focus on. That's very beneficial as well. A lot of my patients like to drink things like a warm glass of milk, which is beneficial. As I said before, you've got the magnesium, the calcium, an equal amount of protein and fat. Some people like to take a warm bath. Some people like to read the Bible. Some people like to take a walk. Whatever it is, that imagery or whatever that stimulates your senses to relax is what we're looking for. Now, there are some times that sleep hygiene obviously is not going to play the answer. And so what we look at is several different types of treatments. And as a pharmacist, you know the different types of treatments that are out there. We have antihistamines, we have antidepressants, we have the benzodiazepines, we have the non-benzodiazepines, or the newer GABA agonist. We also have the Arak, which is the newest group of medication antagonist, and we have melatonin. And then we have some of your complementary alternative medications. So when we talk about the antihistamines, we know these are the best things to always recommend. There's only two major antihistamines. There's diphenhydramine and doxalamine. Diphenhydramine basically is the Benadryl product, and you find that in pretty much most of all of your products that are over the counter for sleep. But we have to be cautious of things like urinary retention, constipation, in addition to dry eyes, dry mouth, even cognition or next day fatigue. The antidepressants that we have, or your anticholinergics, such as amitriptyline and doxepin, we also have trazodone and we have mirtazapine. Now, as far as the best population, the one thing that I wanted to let you know about the trazodone is that it helps with sleep latency and helps with sleep continuity. However, paradoxically, there are some people that have a particular type of genetic disorder that actually metabolizes this medication into a stimulant type of metabolite. And so as a result, it doesn't cause them to relax, it causes them to be stimulated. In addition to that, the mirtazapine, the best class of patients in the best population for mirtazapine is actually those patients that are your elderly, that need weight gain because it helps to stimulate their appetite, and that are depressed. And so it kills all three of those stones in one. Now, the ones that we're probably the most familiar with are your benzodiazepines. We have the older generation ones, which are basically the GABA agonists, and there's 5 FDA-approved benzodiazepine agents. Those include flurazepam, temazepam, quazazepam, and triazolam, and prozazepam. Those are the 4 or the 5 that are actually FDA-approved. Now, what these medications differ in, obviously, is their pharmacokinetics and the time it takes them to onset, the time it takes them to durate. And so when we look at this, temazepam actually fits the profile the best. It usually onsets within about 45 to 60 minutes, and it usually lasts about 6 to 7 hours. Your triazolam will usually peak within about 1 to 2 hours, and it's out of your system usually within about 5 to 6 hours. Then you get into things like alprazolam, lorazepam, clonazepam, and diazepam. The reason why some of these are not the most beneficial is because the time that they last can be up to 80 hours, some of them 120 hours. So once again, you're causing that drogginess the next day if you use these solely for sleep. The things we have to worry about these is that they can cause next day fatigue, but they can also cause amnesia, and they have kind of a muscle relaxation type of focus. So I don't know if you're familiar with the newer agents, obviously, that came out, or what we call the non-benzo, or their selective benzo. These are the alpha-1 receptor agonists, and these particular ones are things like Ambien, Sonata, and Lunesta. And these medications, what makes these so much better is that they don't last quite as long, and they peak a little bit quicker than the other benzodiazepines that are your first generation. Typically with most of these medicines, though, that they do require, FDA does recommend that you give at least 7 to 8 hours a night of sleep. You allow that much time for these medications to actually kick in and work. The only one that you don't have to be that stringent with is, of course, the Sonata, which is about a 4 to 5 hour sleep time that you need to allow. The other thing to keep in mind with these medications is that, once again, they can cause retrograde amnesia, and they can cause what they call they'll refer to it as para-insomnias, where a patient oftentimes is kind of in and out of alertness or wakefulness, but they don't always remember what happened the night before, so they can do some weird things. There's some different types of, even sleepwalking or sleep talking or different activities that happen overnight that they are not able to remember. And so the FDA does warn against some of those types of behaviors. They also warn against the fact that none of these medicines are approved for any longer than 6 months at a time. And so I think probably as a pharmacist, what you might be noticing recently is that these particular types of medications are getting on the criteria for your elderly individuals, and you're getting a lot of insurances that don't want to cover them past a certain age. And the reason for this is because of that next day fatigue. There's been studies that have actually shown associations with these medications and increased fall risks. And as a result, insurances will either upcharge the copay or completely stop paying for these medications in patients over the age of 65. Now, the other medications I want to go over, one is melatonin. Melatonin, as I said before, is actually controlled by the pineal gland, which is part of the hypothalamus. And the pineal gland will secrete this melatonin about 8:30, and it keeps your circadian rhythm in check, and it helps to get you to wind down and go to sleep. There is a marketed agent that's obviously prescription only, which is the Trazodone. That's at 8 milligram. There are also a lot of over-the-counter melatonin products that run anywhere between 1, I think they have them as high as 20 milligrams now. When you go to recommend a particular dosage of melatonin, you get a lot of children a lot of times that will come to you, or their parents will come to you. I usually start children out on about 3 milligrams, typically 1 to 3 milligrams, and in an adult, usually between 5 and 10. I never say anything over 10 milligrams of melatonin. The other type of medications that have come aboard is the complementary, some of the complementary alternative meds. Obviously, as pharmacists nowadays, we know that these medications obviously are not regulated. They only go through basically minor types of testing, very small trials. And so as a result, we don't know necessarily if we can extrapolate the medications and the effectiveness of these agents into our whole population. So the way I look at it is, if it works for the patient, there's no other drug interactions, and the price is right, I feel that it's okay to recommend one of these agents. Now, the ones that you might be the most interested in is some of the newer agents that have just come out, which is the Aroxolin antagonist. Aroxin works in conjunction with serotonin in the brain to actually create stimulation. And so as a result, if we antagonize this particular chemical, then we cause a decrease in stimulation and we cause more relaxation. This is also a controlled substance, just like your Ambien and your Lunesta and your Sonata. It's also controlled. The doses range anywhere between 5 and 20 milligrams. The brand name or the marketed name is Balsamo right now. You might be starting to get some of this coming in on your shelves. It is contraindicated in patients that have narcolepsy. And once again, it's just the same as the other agents. There's never been any type of superiority type of trials that are out there. All of the trials that are out there right now are actually comparing this to placebo. And so obviously this compared to placebo has been shown effective in both sleep latency and sleep continuity. Sleep latency is the ability to help with falling asleep, and sleep continuity is maintaining sleep. So these charts here that I've got on the next couple slides is basically just information that kind of helps you understand what some of the side effects are that are related to some of these agents and the dosings that they range in, and some of the clinical pearls. Like I said before, I mentioned a couple different things about some of the newer non-benzodiazepines or the GABA agonists, where I had mentioned that basically make sure that you're allowing for most of these agents 7 to 8 hours of sleep time that's necessary. Other than that, we are basically down to conclusion and my references. So we've covered pretty much the significance of the sleep. We've covered the statistics of how poor Americans are doing at getting their sleep at night. We've talked a little bit about the physiology behind what happens in sleep and the anatomical structures that are involved in sleep, as well as sleep hygiene, so the non-pharmacological focus, as well as the pharmacological focus. So I'm going to open it up now if you have any questions. Please feel free to ask. These are my references that I got most of my information from, so you can certainly look those up if you'd like, to look up some of the other information that maybe I didn't cover or you have questions about. So thank you for your time. All right, well, thank you for listening. I do appreciate it. And once again, if there's any questions or anything else, you can always look me up. I can give you my email address, and you can write them there, or you can send them to Mary. Thank you so much.